So right now I've marked this patient out. She's very brave. She was here yesterday, hasn't taken any sedation, just straight local. We did the front of her legs, the sides of her legs, so we're back today to do the back of her legs today. Yesterday we did the front and the sides. I don't like to do more than 2 different areas at once. She saw me before she came in this room, stood up, and I put these marks. I divide up into squares. The colorations mean different things for me. And what I'm going to do now is prep and drape. She's wide awake. You can say hello from over there.
Hi.
And she's a happy camper. Happy enough that she came back today for more. So this is Hibiclens, which is just an antiseptic. It's more cold than anything else. And it's a sterile field. After I finish prepping her, I'll put a bunch of drapes, but we'll stop the video at that point because that's not very exciting. And then we'll resume shortly. So I'm just prepping it. I'll prep both legs at once. And this whole procedure will take about an hour to an hour and a half from when I start. She'll be able to go back to work tomorrow. I don't like her to exercise for 5 days, but she can go back to work, she can shower tomorrow, she can have sex, go for walks, just no intensive exercising for 5 days. Sometimes they get some bruising, sometimes they don't, but it always goes away. So what I've done now is I've numbed up this side of her hips, and we've numbed up in the process of numbing this. So I've got the cannula, which you see, I slip underneath the skin, and then I've infiltrated. Again, just to attest, my patient's wide awake and is surviving. Say hello to the audience for me.
Hi.
So, sounds relatively happy. It can be a little uncomfortable, but it's not terrible. And as I said, she's taken absolutely nothing before she came in. So what I do is I infiltrate when I step on the pedal, the medicine comes through the IV tubing, and I numb up this area. And I'll essentially go through all these squares underneath the skin. Okay. So I've completely numbed her up. As I've indicated previously, I've marked the squares. This is the laser, and you can see there's a little guide light. This isn't actually the laser beam, but it has a little light. And what I've done is I've already numbed her, I slide underneath the skin, and I move it back and forth. Every time I step on the pedal, laser beam comes through, and what it's doing is just breaking up the septi. The septi, which I've marked in green, are what's bringing her skin in, which is so common in cellulase. And then I'll turn the handle a different contour, and I'll deliver heat to the underside of the skin on the inside, and that does 2 things. It causes the skin to tighten, and it also stimulates collagen and elastic fibers to regrow. And that's the reason why women get cellulite, is they have a decrease in collagen and elastic fibers. I can't make it perfect ever, but I can improve them. They do have to be patient. They'll keep getting better for at least 6 months.